The liver performs many vital functions such as processing and storing nutrients, producing substances that aid digestion, breaking down and removing toxic substances, and producing molecules that help form blood clots in the healing process. Sugar is stored in the liver as glycogen. When blood sugar levels become low, glycogen can be broken down and released into the bloodstream as glucose. The liver breaks down harmful substances into inactive byproducts. Some of the byproducts are mixed into the bile and excreted into the intestines. Others are excreted into the blood, from which they are filtered by the kidneys as urine. The liver also produces bile, a greenish yellowish fluid that aids digestion by making cholesterol and fat easier to absorb from the intestines. Bile is stored in the gallbladder and released into the intestines after meals. Virus disorders can damage the liver. Hepatitis is inflammation of the liver that commonly results from a viral infection, such as hepatitis virus. The liver can repair some damage by making new cells. However, repeated damage may lead to formation of non-functional scar tissue called fibrosis. If damage is widespread, cirrhosis.
Cholecystitis is the condition affecting the gallbladder in which there is inflammation of the gallbladder wall, which can be acute or chronic, mainly caused by gallstones characterized by pain on the right upper hypochondriac region, which usually is associated with fat meals. Cholelithiasis, commonly known as gallstones, may occur if bile contains too much cholesterol and or bilirubin. Too much cholesterol and or bilirubin in bile may crystallize, hence forming stones. As the gallbladder contracts to eliminate the bile into the small intestine after a meal, these stones may clog in the cystic duct or common bile duct and block the flow of bile into the intestines, hence leading to inflammation of the gallbladder. If the stones tend to block both the bile duct and the pancreatic duct, it may also lead to inflammation of the pancreas, which is pancreatitis. In chronic cholecystitis, if the gallbladder is severely damaged, cholecystectomy is indicated. Cholecystectomy is the surgical removal of the gallbladder. During a laparoscopic cholecystectomy, the surgeon will begin by making small incisions on the abdomen and inserts the instruments needed for the procedure via the same ports. Carbon dioxide, a gas, is then pumped into one of the ports to enlarge the abdomen and thus creating more and enough room for the surgeon to clearly view the gallbladder. The surgeon will then clamp and cut the bile duct, cauterize the area, and finally remove the gallbladder through one of the ports. After the procedure, the instruments are removed from the abdomen and the incisions are closed with stitches.